Hey everyone, and welcome back to the deep dive. Today we are going to be talking about something that's, well, kind of flown under the radar for a while now. Antimicrobial resistance, or AMR for short. You know, it might not be grabbing headlines every day, but this thing has the potential to really shake up modern medicine as we know it. Like, imagine those weeds in your garden that just won't die no matter what you spray on them. That's basically what's happening with germs and the medicines we use to fight them. And trust me, this is a global issue, and it's a silent threat that could cause, well, millions of deaths in the coming years. Scary stuff, right? But it affects everyone, and that's why we're here today. To dig into this, I've got an expert with me who will help us unpack all this. We'll be looking at real-life stories, some pretty surprising facts, and most importantly, what we can actually do about it. So let's get right into it.
You know, it's funny how we always think about these apocalyptic scenarios, like big dramatic events, right? Yeah. But honestly, the most dangerous things are often the ones that creep up on us silently. And AMR is, well, it's a perfect example of that. Just try to picture a world where a simple cut or a routine surgery could actually become deadly because the medicines that we rely on just don't work anymore. That's the reality we're facing if we don't get a grip on this. It's
not just about a few stronger bugs, right? We're talking about the foundation of modern medicine being at risk. Like, no more antibiotics. That's pretty terrifying. But before we completely freak out, let's break it down. What exactly is AMR?
Basically, AMR is when these microorganisms, like your bacteria, viruses, fungi, parasites, they develop the ability to resist the drugs that we use to, well, kill them. It's like a microscopic arms race. You know? The germs are constantly evolving to outsmart us. And this resistance can spread from person to person, across countries. It's a global problem.
Okay, I get it. So it's like those super weeds that just keep coming back in your garden, no matter what you do. The germs are basically becoming immune to our weapons.
Exactly. It's a great analogy. And we're already seeing this happening in hospitals all over the world. Take MRSA, for example, methicillin-resistant Staphylococcus aureus. It was once easily treated, but now it's a serious threat, especially for people with weakened immune systems. It's a nightmare for hospitals trying to contain it.
Okay, yeah, MRSA is definitely scary stuff. But you mentioned it's not just bacteria, right? What about viruses, fungi, parasites? Are they getting in on this resistance action too?
Absolutely. Drug-resistant malaria is a huge concern. It makes this already deadly disease even harder to fight, especially in areas with limited resources.
Yeah.
And then there's this fungus called Candida auris. Scary stuff. It can cause really serious infections, especially in healthcare settings. And the thing is, it's resistant to a lot of our antifungal drugs. And to make matters worse, it can live on surfaces for a long time, making it really tough to get rid of.
Candida auris. Wow, I've never even heard of that. But it sounds like something straight out of a sci-fi horror movie. So we've got bacteria, viruses, and fungi all developing resistance. This is starting to paint a pretty grim picture.
Yeah, it's a complex challenge.
Yeah.
For sure. But the first step to finding solutions is understanding the problem. So how did we get here? How did we end up in this, well, microscopic arms race with these superbugs? Did we accidentally create them in a lab or something?
Yeah, it's easy to imagine some mad scientist scenario, but I'm guessing the reality is a bit more complicated.
Well, it's not exactly a lab accident, but our actions have definitely played a role in fueling this crisis. There are three main drivers of AMR, all interconnected, and all stemming from human behavior. The first, and maybe the most alarming, is the overuse of antimicrobials, especially antibiotics.
Overuse, huh? So basically popping antibiotics for every little sniffle, even when they're not really needed.
That's a big part of it, yeah. See, antibiotics, they only work against bacteria, not viruses.
Yeah.
But they're often prescribed for viral infections, like colds or the flu, where they're totally useless. Studies actually show that up to 50% of antibiotic prescriptions are unnecessary. It's crazy, right? And all this overprescribing. It's like giving bacteria a training manual on how to become resistant.
Wow, 50%? I had no idea it was that bad. So it's like we're accidentally training these microscopic enemies to become stronger by exposing them to all these unnecessary drugs.
Exactly. It's like we're giving them a workout, helping them build up their resistance muscles. And this misuse, it's not limited to healthcare either. Agriculture plays a role too.
Agriculture? What do farms have to do with superbugs? That seems like a strange connection.
It might sound surprising, but the way we raise livestock is a big part of the problem in a lot of countries. Antibiotics were routinely added to animal feed, not to treat infections, but to make the animals grow faster. It's cheap and effective, but it comes with a cost. It creates a perfect breeding ground for resistant bacteria in those animals. And these resistant bacteria can then jump from animals to humans. through direct contact or contaminated food.
So we're basically mass-producing superbugs on a farm.
Right.
And then potentially eating them.
Yeah.
That's not a very appetizing thought.
It's a sobering thought, for sure. And it shows how interconnected our actions are with this problem. But there's another factor at play here, the lack of new antibiotics being developed.
Yeah. Why aren't we making new drugs to fight these superbugs? Isn't that the obvious solution?
It seems logical. But developing new antibiotics, it's a long, expensive, and risky process for pharmaceutical companies. And since people only take antibiotics for a short time, the profits are much lower compared to drugs for chronic conditions, the ones that people take for years. So we're stuck in this vicious cycle. Overuse, misuse, and a shrinking supply of new weapons.
It's like trying to fight a growing army with less and less ammo. A recipe for disaster. And we've seen the consequences, like with MRSA. But what does this resistance mean for us on a larger scale? How does AMR actually impact people's lives beyond, making infections harder to treat?
That's the key question, and that's where the true cost of AMR becomes clear. It's not just about treating individual infections. It's about the potential collapse of modern medicine if we can't rely on antibiotics. Surgeries, organ transplants, even cancer treatments, they all become incredibly risky. And simple infections, they could once again become deadly threats.
So are we talking about going back to a time before antibiotics, where a simple cut could kill you? That's scary. But is it really that bad? Are there real-world examples of AMR causing this kind of devastation?
Sadly, yes. AMR is already impacting lives around the world. To really understand the problem, let's look at a couple of examples. India, for instance. They are dealing with a terrible tuberculosis crisis, driven by drug-resistant strains. Treating these resistant forms, it takes years and involves strong drugs with harsh side effects. It's a nightmare for patients and a huge burden on their healthcare system.
It's heartbreaking to think about all those people facing such a long and difficult treatment. It's a reminder that this isn't just some theoretical thing. This is real for millions of people.
Right. And it's not just a problem in developing countries either. Here in the US, we're seeing a scary increase in drug-resistant gonorrhea. It used to be easy to treat with antibiotics, but now there are strains that are resistant to almost all the drugs we have. We're getting closer and closer to a point where gonorrhea is untreatable.
Untreatable gonorrhea. What happens then?
That's the grim reality we're facing if we don't act. And it's not just individual health that's at risk. The World Bank estimates that by 2050, AMR could cost the global economy $100 trillion.
Yeah.
That's trillion with a T.
$100 trillion. That's more than the entire global economy right now.
It's a number that's hard to even imagine. But it shows how urgent this situation is. We're talking about lost productivity, higher healthcare costs, overburdened healthcare systems, and the possibility of widespread social and economic upheaval. The consequences of doing nothing are almost too big to grasp.
Okay, so AMR is a massive problem. It could derail modern medicine and cripple the global economy. That's a lot to take in. Honestly, it's a bit overwhelming, but it can't be all doom and gloom, right? There has to be some hope, some way to fight back against this microscopic menace. I feel like we're teetering on the edge of this, like a microbial cliff here, but there has to be a way to climb back up, right? What are the strategies, the weapons we can use in this fight against AMR?
Yeah, you're right. It's not a lost cause. There are effective strategies, but it takes a multi-pronged approach, a global effort to tackle this from every angle. It's like a war on multiple fronts.
Okay, so a multi-pronged attack plan. What are the key battlegrounds in this war against superbugs?
First things first, we need to invest in research and development, big time. We need new antibiotics, new drugs that can outsmart these resistant strains. But it's not just about throwing money at the problem. We need to think outside the box.
So, are we talking about some next-level scientific stuff, like genetically engineered antibiotics, or something straight out of Star Trek?
That's not as far-fetched as it sounds. Scientists are exploring things like phage therapy, which uses viruses to actually target bacteria, and antimicrobial peptides. These are naturally occurring molecules with antimicrobial properties, but these are all still in the early stages of development.
Okay, that sounds promising. But while we're waiting for those scientific miracles, what can we do right now to slow things down? Surely there are things we can do to slow down the spread of AMR.
Absolutely. We need a change in mindset. We need to focus on using the antibiotics we have responsibly. Doctors need to be really careful about when they prescribe them, making sure antibiotics are only used when absolutely necessary.
So, no more prescribing antibiotics just in case. It's like Doctors need to become antibiotic detectives.
Exactly. It's about weighing the risks and benefits, making sure antibiotics are a last resort, not a first line of defense. And patients need to understand that antibiotics aren't a magic bullet. Demanding antibiotics when they're not needed just makes the resistance problem worse.
You know what? I'll admit, I've been guilty of that in the past, thinking an antibiotic would help me get over a cold faster. But now I realize I was actually part of the problem. But what about when you really do need antibiotics? What can patients do to make sure they're using them responsibly?
That's a really important point. When you are prescribed antibiotics, it's crucial to finish the entire course. Even if you start feeling better before you've taken all the pills, stopping early gives some bacteria a chance to survive, and those survivors are often the ones that are most resistant. It's like leaving a few enemy soldiers alive after a battle. They can regroup and come back stronger.
Got it. Follow the doctor's orders, no shortcuts or self-medicating. But even with responsible prescribing and use, we're still facing this problem of not enough new antibiotics being made. What are we doing to encourage the development of new drugs?
That's a tough one. It requires governments, pharmaceutical companies, and research institutions to work together. We need to make developing new antibiotics profitable for those companies, maybe through government funding or tax breaks. There are also things like the pull incentive model, which guarantees a return on investment for companies that develop new antibiotics, even if those drugs don't sell well right away.
So it's about making it worthwhile for these companies, making it less about profits and more about the greater good. But even with new drugs, won't we eventually face resistance to those too? It feels like an endless cycle.
You're right, resistance is inevitable. But we have another weapon, infection prevention. If we can reduce the number of infections in the first place, we won't need as many antibiotics, and that slows down the development of resistance.
So back to basics. Wash your hands, get vaccinated, stay home when you're sick. That seems almost too simple.
Don't underestimate the power of those simple things. They're really effective at stopping infections from spreading. And it goes beyond what individuals can do. We need better hygiene and sanitation in hospitals and healthcare settings, where resistant organisms can spread like wildfire.
Wow, it's amazing how something as basic as hand washing can make a difference. But AMR is a global problem, right? These superbugs don't exactly respect borders.
Exactly. Global collaboration is key. It might be the most challenging part, but it's absolutely essential. We need a coordinated international effort to track how resistance is spreading, develop surveillance systems, share data, and implement best practices.
So like a global intelligence network for superbugs, sharing intel on what works and what doesn't, learning from each other. It sounds like a huge undertaking.
It is. And there are challenges. Data privacy, resource allocation, and the possibility of countries putting their own interests first. But organizations like the World Health Organization, they're working hard to facilitate international cooperation and develop global action plans.
Okay, so even with all this, research, responsible use, infection prevention, global collaboration, it still feels like a tough fight. Is there any reason to be optimistic? Can we actually win this war against superbugs?
It's a huge challenge, for sure. But there is reason for hope. Remember, we're not starting from nothing. We have a lot of knowledge, we have scientific tools, and there's a growing awareness of this problem. The key is turning that knowledge into action, both individually and globally.
So it's not just about scientists and policymakers, it's about all of us making responsible choices. I like that. But what exactly can our listeners do? I mean, we're not all infectious disease experts.
You don't need a PhD to make a difference. There are simple but powerful things everyone can do. First, don't pressure your doctor for antibiotics if you have a viral infection. Trust their judgment. Let them be the antibiotic detectives.
Okay, so no demanding a quick fix. When rest and fluids are the best medicine. What else?
Hygiene. Wash your hands thoroughly and often, especially before you eat and after using the bathroom. It's such a simple thing, but so important.
It's funny how something we learn in kindergarten can have such a big impact on global health. We should have a global hand washing day or something. Okay, but beyond hygiene, what else can we do to be part of the solution?
Support policies and organizations that are fighting AMR. Write to your elected officials. Donate to research organizations. Talk about it on social media. Those actions may seem small, but they amplify the message and create momentum for change.
So use our voices, our wallets, our social media to push for action, to make this a priority. I love that. It's like we're moving from despair to action, from feeling helpless to feeling empowered.
Exactly. That's the shift we need. This is a fight we can win, but we have to work together. Individual actions multiplied across communities and countries can create a powerful wave of change.
I love that image. A ripple effect. Individual actions making waves. It's a great reminder that we all have a part to play in shaping the future, not just for ourselves, but for generations to come.
It's true.
And that's what I find so inspiring about this. It's not just about understanding the problem. It's about being equipped with the knowledge and the motivation to be part of the solution.
That's what the deep dive is all about, right? Taking something complex, breaking it down, and giving listeners the power to make informed choices.
Exactly. This has been an amazing journey. And I have to say, I'm feeling a lot more informed, engaged, and optimistic than I was when we started.
Me too. Remember, knowledge is power.
Yeah.
The more we understand about these challenges, the better prepared we are to overcome them.
So it's been quite the journey, huh? We started in a pretty dark place, but now we're seeing some glimmers of hope. I'm feeling more hopeful, that's for sure. But what does a future where we've actually beaten AMR look like? Can you paint a picture for me?
Well, imagine a world where we have these, like, next-generation antibiotics, smart drugs that can outmaneuver even the toughest superbugs. And these drugs, they're only prescribed when they're absolutely needed. And people understand. You got to finish the whole course, no cutting corners.
Okay, so antibiotics become this precious resource again, not just something you take for every little sniffle. I like it. What else?
Hospitals are like hygiene fortresses. They've got these super strict infection control protocols. Hand washing.
Yeah.
It's not just a suggestion. It's like a way of life for everyone. Doctors, nurses, visitors, everyone.
Okay, I can see it. And what about outside the hospital?
Well, you see public awareness campaigns everywhere about AMR.
Yeah.
Billboards, radio jingles, the whole 9 yards. People actually get it. They know the risks, how to protect themselves, and they're demanding action from their leaders.
So it's a real shift in mindset, right? We all realize we're in this together. But what about the global challenges? How do we get everyone on the same page, working together to fight this thing?
Okay, imagine this. A global surveillance network. It tracks the emergence and spread of these superbugs in real time, like a superbug weather map. Countries share their data, they pool their resources, and they work together on research. It's a true global partnership.
Ambitious, but yeah, definitely necessary. Kind of like united we stand, divided we fall, right? But with a microbial twist, is this actually doable? Or are we just setting ourselves up for disappointment?
It's tough, for sure, but I think it's possible. Remember that quote we talked about from Dr. Margaret Chan? Antimicrobial resistance is a slow-motion disaster, but it's a disaster that can be averted. We have the know-how, the tools, and the desire to make a difference. The big question is, will we act fast enough before this slow-motion disaster turns into a full-blown catastrophe?
That's the question, isn't it? It feels like we're at a crossroads. One path leads to a future where a simple infection could kill you. The other leads to a future where we outsmart these superbugs. It's scary and exciting all at the same time.
Yeah, that's the thing about these big challenges. They show us how vulnerable we are, but they also push us to be smarter, tougher, and work together. It's a test, of what we're really made of.
And hopefully proof that we can learn from our mistakes and build a better future. So to everyone listening, remember, you're not just along for the ride here, you're part of the solution. Every choice you make, every action you take, it all matters.
Absolutely. Wash your hands like you mean it. Don't pressure your doctor for antibiotics when you don't need them. Support policies that fight AMR.
Yeah.
Tell your friends and family about this. These small things, when millions of people do them, they can change the world.
I love that, like a ripple effect, right? Millions of small actions creating a wave of change. We all have the power to shape the future, not just for ourselves, but for generations to come. That's what I find so inspiring about this whole thing. We're not just learning about the problem, we're figuring out how to be part of the solution.
That's the deep dive in a nutshell, right? We take a complicated issue, break it down, and help people make informed decisions.
Couldn't have said it better myself. This has been an incredible journey. I feel like I've learned so much, and I'm definitely leaving here feeling more hopeful than when we started.
Me too. And remember, knowledge is power. The more we understand these challenges, the better prepared we are to overcome them.
So on that note of cautious optimism, we're going to wrap up this episode of The Deep Dive. Thanks for joining us on this deep dive into antimicrobial resistance. Remember to stay curious, stay informed, and stay involved. The future of health depends on it.